Code Red, industrial accident in the city centre, track.
It's a busy start to the day for ambulance crew Willie Hanna and John Pollard. Their first call is to one of Liverpool's many construction sites.
It's a report of a 25-year-old male who's been hit with a forklift truck. It's unclear whether he's in the forklift truck and had an accident or he's actually been hit by the forklift truck. On the right here.
Peter Green was working near to a 5-ton forklift when he got a little too close.
All right, fella, what's happened to you?
The fork truck's just gone
Over your foot?
Yeah.
All right, get that bed out for us, Will. Can you feel... Oh, you've got my steelies on. Can you feel me touching your toe there?
I can't feel it now.
The stack of trucks rolled over his foot, over the bridge of his foot. He has got movement and sensation there. So what we'll do is we'll get you in, take your shoe off and have a look at it. Get you off this cold floor. Slip your bum on there, fella. That's it.
By law, steel-toed boots must be worn on building sites.
No worries. All right, cheers for that, fellas.
You're going to lose your foot, but we've saved your boot.
Just give us one of your arms, fella. You've got about 87 onion skins on here, fella, yeah?
Yeah, it's cold. Not too bad, do we?
I think it's gone over the side of your foot, rather than right
what it
over.
was. It twisted me foot, like, and he got it off as quick as he could, do you know what I mean? It just shit.
You feel that, yeah?
Yeah,
Feel all of them, yeah? Can you wiggle your toes? Doesn't hurt, unduly.
It's just short, to be honest. The blood pressure's a bit high, but you'd expect that, like, if somebody run over you with a truck, wouldn't you?
How's the pain? I mean, if it's agony, I can pop a needle in your vein and give you some painkiller.
No, I couldn't stomach it, Dad. First day on this job as well, on this one. Yeah.
It doesn't look like you've broken anything, to be honest with you, but we'll get you up there and get you checked over.
Peter's taken to the Liverpool Royal for x-rays.
Excuse me. Hello, Major Sister.
Well, I'm just thinking because they're fine in there.
Yes, that's great. Go down.
Can ECG contact resource, please?
Consultant Aris Supaya has just come on shift.
You've got quite a nasty infection there in your leg.
Family man Billy Walker was enjoying an uneventful day in the city when his right leg became very painful.
That leg has actually become like that in the space of 2 hours. It started out with a few blisters, but in the last 2 hours it's gone like that, and also spreading all the way up here. Now, if you look at him, he's a bit sleepy, and we're worried that this could be the flesh-eating bug that's going up his leg. It's a specific bug that gets into a cut or something and spreads out the leg, and what it does is it just eats away on all the flesh, and it can completely destroy your leg in a space of 2 hours. Usually you never find the source, really. Anybody, young people, old people, anybody could get the diabetics, anybody. You could be completely well and get this. He's got 2 lesions on his arm, which may be bruises, I don't know, that one there, but that one's fairly new, and his arm is mottled.
A surgeon has come to examine Billy. He needs an emergency operation.
What they need is they need to cut away all the tissue that's dead, and quite often that may be down to bone, and in which case you may need to amputate the leg as well. They try to save it as much as they can, but they cut away everything until they can see fresh, healthy tissue. It's a very, very serious condition.
Billy is only dimly aware of what's happening.
And we're going to put a needle in your neck, okay? It's very important. All right, we got one in. I would like a central line, please. Thank you.
But before the surgeons can operate, Ara must stabilise Billy by giving him fluids.
Rajiv, what I want you to do is take that hand, keep it there, and keep him calm, okay? That's your job.
All right, so can you just straighten that arm out for me, sir?
Yeah, this needs to be in 10 minutes. You're going to feel a sharp needle in your neck now. Stay very still. What about now?
All right, my love. Listen, Bill, you're doing great there. You just relax, sweetheart.
Bill? Hiya. Bill?
36 now.
Give him some atropine. Give him some atropine.
Billy's blood pressure is already dropping too quickly,
Secure the line.
and he falls into cardiac arrest.
Okay, go.
Can the OTA pop down from resource 1, please?
Sarah, you're going to get some things just to secure this and then we've got a line.
Have you got an output now?
No, we're just feeling for now.
You've got a change in rhythm there.
What change is that?
Yep. Okay, let's keep pouring the fluid through.
Right. Have we secured that?
Still not had that clindamycin, that's there.
Guys, whoever's not working here, leave the cubicle now.
All right, darling, all right. Do you need some anaesthetic?
He needs to go to theatre to have the bugs removed from his legs ASAP, really. Because while we're talking, the bug is actually eating up all the tissue in his legs. And that's why he's so sick. going to have an operation up there now. I just hope he survives the transfer up to the operating room.
Mid-morning, and most of the city's ambulance crews are on the road.
Well, looks like we've got a bit of a flat, so we must have, while we're at the docks, must have gone over a nail or sharp metal, because it was scrap metals, mate, it's where we went. So what I need to do now is get the tyre size, which I've just got, the make of the tyre, get under control, and they'll get tyre services out.
Ian and Paul are temporarily out of action.
As we get the bruise on, Paul. Ooh, fluffy.
About a gazillion calories, isn't it?
Back on the road, and they immediately have an emergency call.
We've got a 40-year-old male who's been involved in a RTA between a motorcycle and a car.
I see, so you've been taking a avoided accident and you've come off. Okay, right, I understand that. All right, okay. Now, have you got any pain in your neck at all? And no pain down the middle there at all? No pins and needles in your hands or your arm?
I tried to pump the bike on.
Right, okay. All right. Well, I'll tell you what we'll do. We'll lie you flat. Okay, let's lie you flat. Right, that's the saw, like. Well done. Keep going. Keep going.
The motorcyclist is trainee teacher Stephen Craven.
Okay, Steve, we'll just relax. Give us have a look at this arm. Okay, can you move your fingers and your wrist and everything? Okay. Where was the main pain on that? Just anywhere?
Just my little foot.
Just your little...
I just pulled it.
All right. So you got no more pain anywhere else, no?
Yeah.
No? All right, so we're just talking mainly about your bike now. Okay. All
I'll
right.
let go of the bike.
You just dumped the bike and you've ended up under there. Okay.
I had no choice, he just came
That's
right
not-
into me.
This young man's been coming along here on his bike and he's been forced out by another car and he's had to take some avoiding action. So he wasn't actually hit by the car, this car's actually got all damage to it. He's actually dumped the bike and he's ended up underneath the car. The car itself was stationary. The only impact is from himself hitting the deck when he's dumped the bike. So, like you see, he's got a leg injury and that seems to be all that he's got.
Get that leg together with that one. So when you're right there, I'll get the feet. All right, then you're ready.
You don't lose the old tricks there. On three, boys?
Yeah.
On two, three. Oh, yeah. Good lad. Chill. Right, relax back there, bud. We'll get him in the back, do some basic obs, go over this, just give him a thorough check-up, and then we'll just take him around the Royal. He's very lucky.
It's, you know where your ankle bones are?
Yeah.
It's right above the ankle bones.
Oh, either side,
Yeah,
around that
go-
side, either way.
Yeah, go above it, go straight to drop.
All right, well, I'll leave that because that's nicely compacted.
Just a little bit. Just a touch.
The car involved in the accident has driven off.
The gentleman I hit stayed. The one that was forced to cause the accident has got off, so it's now on my responsibility, on my insurance.
It's a bit crazy today. There's patients absolutely everywhere. Do you want to come through? I'll see you in there.
No, Paul's got them for me. I will be able to talk to you now in a minute.
Grant.
It's a bit mad.
Grant. Right, this young man is Stephen. He wasn't actually hit by a car, he was... So I think he'll be okay. If he could have fractured his ankle or something like that, I don't know. Until the x-rays come through and say anything, I don't know.
Also in minors is junior doctor Amir Khan.
Right, we've got a 22-year-old guy who's come in. He's been hit over the head with a metal bar. So let's go and see what's going on.
FUL.
And can you see any double vision? No, just blurry. That's fine. Ooh, okay, so it's quite a big cut. Just getting ready a suture trolley just to put some stitches in that laceration.
I've never had stitches before, you know.
Have you not?
What it was, I was walking down my mum's street. Next thing is, when I heard running behind me, and when I looked behind me, just got a metal bar to my head.
Oh, I always get this wrong when I try and guess how many stitches. So I'm gonna go for, let's have a look. 1, 2, 3. I'm gonna go for 6. but I bet that's wrong. The worst thing about this, Kevin, is the anaesthetic, because that's when you actually feel it, when I'm numbing the area, and it goes in both sides, above and below the cut. All right?
One thing I'm scared of.
Needles.
Yeah.
Oh. Let's have a look. Doing really well. All right.
I'm listening, I'm not crying on telly. It's just my eyes watering.
Okay, just put your head back for me. I'm not tall enough for this, I have to stand on my tiptoes. You all right, Kevin?
Yes.
You didn't feel that one?
No, no.
5, not quite 6. Wrong again. One day I'll get it right. All right, Kevin, I don't think we need to give you any antibiotics as well, but I will give you some painkillers because this is going to bruise and hurt tomorrow.
Yes.
All right. Hopefully it won't scar too bad. And yeah, I'm happy with it. Looks all right.
If it does scar, it's all right. It only goes with the rest of them.
Absolutely. Ladies love scars.
I know they do, don't they?
We've just been sent to the city centre for somebody who's unconscious. It's a 43-year-old male who's either passed out or is unconscious.
John and Willie have been called to another building site.
All stairs, is it? Yeah. No lifts? Not working, yeah. We just got as a collapse, somebody passed out, so it's one of the workmen actually working on the building. Hopefully it's just a normal pass out and it's not an accident. It's still going up. I had to get the oxygen on myself, I think. Not how many more? What? What's happened?
Just felt the tightness in my head and failed. Well,
you fainted?
Everything.
Do you suffer with anything normally? He's come to work today, had a bit of a restless night overnight and has collapsed this morning. He's quite pale, his pulse is quite fast and he's vomited this morning. How long was he out for?
The last time I mine was at 49.
Right.
So I came up here, then I got a phone call.
Right. He's probably walking up them stairs, isn't that? Just done me in.
Well, like I was feeling okay. I done that jumper and the vest on top of this, no type of thing. Maybe it was warm.
Well, you've got to, haven't you? Because it's the cold, isn't it? It's freezing. What we'll do is get you downstairs into the ambulance, and we'll do a few tests on you, see what the score is. You got any pains anywhere?
No, I'm okay there, but a sore head and
just a bit of a headache. Okay then, Ray, let's go, eh? So you got it's easier going down and up. What we'll do, do a 12 lead while we're here. As relaxed as you can for us, please, Ray. 148 over 106, what did you have it before? So it's come down a little bit. Unfortunately, there's nothing glaringly obvious, you know, jumping out from the screen at us. So it's a case of getting all the clues together, see what, you know, what you can find and pick the bones out of it. And obviously then there's further tests the hospital do. They'll do repeat ECGs, blood tests, may keep them in, just see how you go on for the day.
Associate Specialist Rob Hunter is in resus.
Did you get any neck pain anywhere?
No, sir.
Good, good. And then just rest your head flat a sec.
52-year-old Sanjay Rathore is an accountant.
Right, you've got a few lumps and bumps and cuts. You've got a huge cut there that's going to need stitching. Sorry.
Nice and still, my love. Squeeze my hand.
Just got out of a taxi. He's been attacked by two folk that have attacked him with what appears to be, according to the taxi driver, a full bottle of vodka.
You think of
All right, we'll sort that out in a minute.
There is an arterial bleed. I can see it spurting away now. Is it gone all over the machine?
Oh, yeah.
Oh.
It's all right.
No, what are you doing?
I'm just putting stitches in, yeah.
Of course he does.
we need to clip this and tie it off because he could lose quite a lot of blood potentially from this, so the sooner we tie it off, the better. Well, I've put one internal stitch in, I've gone underneath the artery and tied it off, ligated it. Right, sorry. Right, well that seems to have stopped everything. This cut to the eye, this laceration just above the eye on the orbit, it's right down to the bone.
So at the end of the day, I've had a good beating.
You have. I think I can feel a skull fracture. So we need to do a head scan, brain scan.
Why did I got beaten up? What for? Or what did I do?
You were just probably there, hon. The wrong place, the wrong time.
It's not nice though, is it?
It isn't.
A CT scan will confirm if the attack has caused damage to his brain.
Just keep your head really, really still, okay?
There's a little bit of brain swelling, some bruising. There's no evidence of a fracture, which is surprising because I definitely could feel a depression.
Oh, good. I did all my medical attachments here. So I've been in this hospital for effectively 10 years, 10, 15 years, yeah. And right through medical school, I did all my attachments here. I used to study just in the library because my house used to be so cold. I couldn't study at home. I used to sit in the library and study. So I know all the canteen girls, cleaners. Now, how are we doing, Florence? Have we got beds?
No.
No?
The medical beds are coming up quite slowly.
Okay.
But CDU's full and obviously orders full now.
Ara's hospital is a bewildering place for his next patient, Keith Prowse.
You busted your leg? All right. Let me take this off.
Yeah, I want a plaster, please.
Yes, anybody?
No, stop it. No, no, stop it.
Let me just have a look.
No, I said the plaster.
Oh, dear me.
He's going to look at it. No, I want a plaster, please.
Keith lives with carers who help him to manage mental health problems.
Plaster it then?
Yeah.
All right. Before we do the plaster, I need to get an X-ray.
No.
I can't. No, I can't plaster without an X-ray. It's up to you.
Yeah, with an X-ray.
All right. No, Keith. Hang on.
There you go. Just going to do it slowly. Plaster.
All right, buddy. There we go. Well done. Keith has broken his leg, but he's not telling us anymore. And I think he's very scared and afraid, and he doesn't want us to touch it. But his leg's completely broken.
Keith's right leg was run over by a car, but he can't remember the accident.
Keith, I need to get an X-ray.
Yeah.
Can I do that, please? All right.
No, thank you.
Okay.
No, plaster, please. No.
No shouting. No shouting.
No.
If you shout again, I will walk out. I know it isn't, but don't shout at me.
I'm not joking.
Okay.
Sorry.
All right, no problems. Listen.
Sorry.
Okay, listen, Keith. Okay, guys, give me a second with Keith, will you? Keith. I'm really worried about your leg. Okay?
You don't have to be.
Because it's broken really badly.
No, it's not.
It is, mate. Listen.
I know what's wrong with it.
No. Okay, I know you know what's wrong with you, but listen to what I'm saying, okay? I know you want it in plaster, but I have to X-ray it first.
Yeah.
Okay.
Please.
Now, look, Keith. Ideally, I'd like to get an X-ray, but I'm just worried that he's going to start wiggling it about. So I'd rather put it in plaster, hold it in one position, and then it'll give me some time to get a plaster. That leg is going to need an operation. He's going to lose the leg otherwise.
We're going to the toxic area in Liverpool. What we've been given is a 72-year-old female and the diagnosis is she's not with it and staring into space.
She's read the paper from 10 o'clock until she's just finished this paper now.
And she's starting on that?
And she's sitting there shaking, just gazing at her. She's just totally not herself. And she just
So
nosebleeds.
yeah, does she have high blood pressure?
Yeah.
Yeah. Right, Betty, have you got any pains anywhere, darling?
No.
No? Listen, your lad is very concerned about you, okay? He thinks we should take you to the hospital and have the doctor look at you. Should we take you there? How's that?
Are you smiling now? He hasn't been telling you jokes or anything, has he?
No.
She's 71 years of age. She's concerned by her son, really. She was in here with a mild stroke. Since she's come out, she's had quite a few nosebleeds as well. She doesn't tell him, but when he comes home, there's towels covered in blood.
Is she on any anticoagulants?
She was discharged, suffered with hypertension, but her blood pressure was only 143 over 49.
Amir is the doctor who will get to the bottom of what's wrong with Betty.
And how long have you been feeling unwell? Looking at her nose there, it did look like it had some dried up blood around there, so there's definitely been some nosebleeds recently. So we just need to make sure she hasn't lost a significant amount of blood. All right, Elizabeth, can you grab hold of my fingers for me, squeeze them as tight as you can, and pull me towards you? Push me away? That's fine. Her hands do feel cold, and something we measure is called capillary refill. And how we test for that is just press on the end of the fingers there for 5 seconds, and then let go. And it should take about 2 seconds to come back, but as you can see, the colour's it's just come back about there now. So we're looking at about 10 seconds, to be honest with you, which is a lot longer than what it should be. So we do need to warm her up fairly quickly. But she's feeling good. That's a good thing. Potentially hypothermia is a cause of a cardiac arrest. So, but we're working on it to get it up. So I think we're kind of in the in-between stage where if we correct it now, it should be all right.
Ira is starting to gain Keith's trust. He's plastered the broken leg, and Keith has agreed to an X-ray.
Just stay nice and still.
1, 2, 3, 4, 5, 6, 6.5. He's got 7 legs in 7 bits at the moment. So that's a pretty horrific injury, really. On a scale of 1 to 10 of bad breaks, that is probably a 10. The other problem with him is that bone, it actually pierced the skin and went back in. That's why he's got a big cut. So that infection can now travel into the bone. So we have to give him some antibiotics as well.
No, you don't.
I have to put one here.
No, you don't have to go. The hands are fine.
No.
But Keith is scared of medicine and needles, and Ira must earn his confidence again.
Let me show you. I want to put it here. Please, let me do that.
No, please.
Do you know why I need the needle here? Do you know why?
Why? I'm asking.
Okay, because you've broken your leg, okay? And I want to make sure...
But I haven't broken any legs.
I know, but I want to make sure that you got enough blood going around you.
How?
Keith, I'm only trying to help you, okay?
I know that, appreciate.
I'm only trying to do my job.
I know that, appreciate that, doctor.
Okay, so please let me put one needle here then.
No.
No?
No.
All I want is to put one needle here. That's all. Here.
All right, put one needle.
All right, good man. Thank you. Keith.
All right.
Thank you. There we go. See, that's all done now. No more needles, nothing. There we go. If you give him the control and he says, no, I don't want this, that's it, leave it. Come back to it later maybe, but leave it, because he's now in control and he said no. If you try to persevere, you may break that connection again. So it's tricky, you know. How are you doing?
I'm fine.
See, you wouldn't have done that before. You know, that kind of stuff makes my day, really, to be honest. You know, it's all fine treating the heart attacks and, you know, the difficult medical diagnosis. But, you know, sometimes like this, just you know that he wouldn't have spoken to me 2 hours ago. And now I can walk in that cubicle and he will acknowledge me. You know, that to me is a big part of my job, really, to be honest. You know.
As he nears the end of his shift, John is checking up on the progress of another patient.
It was the gent from the building site, the Irish guy. We were just confounded as to what it was. It now turns out that he's had a subarachnoid bleed around his brain. They've just caught it in time, so his outlook is really, really good.
Betty has been covered with a heated inflatable blanket and given warm fluids.
If you just look this way for me, that's it. Oh, it's come up. The temperature's coming up. It's come up by about 1 degree, which is good news. Oh, are you Elizabeth's son? Hi. My name's Amir. I'm one of the doctors looking after her. Do you want to come in? She does sound a little bit chesty when I listen to her, so we've started on some antibiotics, given her some warm fluids and kept her on this bear hugging blanket. So she'll probably be staying with us until we find out the cause of this, really.
Okay.
All right.
Okay. How do you feel? What's that?
That's a good thing. She looks much better. Yeah, I'm far happier with her now than I was when she first came in. The fact that she's eating is a good sign as well.
Betty's low temperature could be caused by an underactive thyroid gland. She'll go to another ward for further tests. As the day draws to a close, Ara has heard that Billy, the man with the flesh-eating bug, did not survive theatre.
It is sad, you know, because someone's lost their life and, you know, it's not something you want to see, but at the end of the day, you have to switch off, you know. All I know is that chap came in and he was very, very, very ill, and we gave him a fighting chance. He went up to theatre, and at least he had a fighting chance. He didn't make it, which is sad, but, you know, I don't look at the situation like that. All I know is I try my damn hardest, you know, try our best. He had a fighting chance. There's nothing more we can do. That's what we do in A&E. Bring me with anything, any traumas, anything. Need anyone to fight. Okay?
Okay. You going home now?
I'm going home now.
You're with me.
He's on till 6. Alan, bring me if there's anything. Okay. I'm on call.
Peter's foot was in plaster for 2 weeks after X-rays showed 2 broken bones. Stephen had fractured a bone above his ankle. He was on crutches for 3 months. Sanjay needed 15 stitches in his head. He left hospital the next day. Raymond needed surgery to stop the bleeding around his brain. He's now back working part-time. Betty spent 4 weeks in hospital with a chest infection. She's home again with her son. And Keith did not lose his leg. 3 weeks after his accident, he was walking again.